Hi all. So welcome to this very interesting webinar that we're going to have today on regaining joy and happiness in practice. As all of us know, this COVID was something which was unprecedented for all of us across the world. It changed our way of practice. It changed our lives as pediatricians itself. So today we thought, amidst all the webinars that are going on about COVID as well as about coronavirus, let's talk about something different as to how we as pediatricians are able to regain the joy that we always found in clinical practice. So can I have slides, please? So as you know, this whole talk is going to be organized by a part of a group which we call as the International Pediatric Association lead group, which is a group of young doctors who were chosen from across the world to form a child health emerging group of leaders of pediatricians across the world. So the reason why we wanted to give a global perspective is that, as you know, this COVID-19 not only brought us all together on a single platform, we almost realized that the challenges that we're facing across the world is almost similar. The whole world has become one as humanity because we realized that that's what we're facing together. We all wanted to travel, right? And I'm sure many of you miss traveling as well. And this brings us closer to each other by at least talking about what's happening in different parts of the world. So with me, I have a few eminent pediatricians from across the world, from UK, Nepal, as well as Ghana, who will be talking to us about how they are facing all these problems in their country and how we can all together regain joy and happiness in our practice. Next slide, please. So as I mentioned, the International Pediatric Association has a logo which says every child, every age, everywhere. And that is the goal which we today want to also follow. That irrespective of the country that we are in, we all are working towards a single goal. That is for every child, everywhere, at every age. So even as pediatricians, I think we need to stand united to understand the problems that we're facing across different countries is almost similar. So to talk about this, I have panelists with me. Next slide, please. We have Dr. Sebastian, who is a consultant pediatrician at Salisbury NHS Foundation Trust in the UK. He's also a lead for the Wellbeing subgroup of the RCPCH Pediatrics 2040. He will be leading the first talk, followed by our next panelist, who is Dr. Smriti Mathema, who is an assistant professor from the Department of Pediatrics, Kathmandu Medical College and Teaching Hospital, Nepal, along with our next panelist, Dr. Angela Osei-Bonsu, who is a pediatrician at the COM4 Onorke Teaching Hospital, Pediatric Neurology Unit, and is also the National Secretary of the Pediatric Society of Ghana. These three speakers are our respective IPA leaders of their respective countries, of Ghana, Nepal, as well as UK, and myself, Dr. Bharath Kumar Reddy, will be moderating this session, and I am a consultant pediatric pulmonologist at Shishuka Children's Hospital in Bangalore, and we represent our respective countries at the International Pediatric Association lead group. Next slide, please. So why are we talking about this? So let me give you a bit of perspective as to why this topic is of interest to all of us today. There was a study which was published recently from China, which spoke about the mental health and psychosocial problems of medical health workers during the COVID-19 epidemic in China. This was a very interesting publication which showed that medical health workers showed a higher prevalence of insomnia, anxiety, depression, somatization, as well as obsessive compulsive disorders more than non-medical healthcare workers. So it was a study which was done with taking the non-medical healthcare workers as a control and analyzed the mental health of doctors and nurses as a case group. And a lot of statistical significance to show that doctors are being affected by this pandemic. They are affected psychologically as well as mentally with all these particular conditions. So this study ultimately threw light and told us, listen, agreed, we are going to be dealing with the COVID pandemic. We are talking about technical and medical stuffs across the world. But are we talking about the mental health of doctors? The next slide, please. This being one of the problems, is also being raised across different parts of the world. One is, yes, the mental health of doctors is being affected by COVID-19 itself. But what are the other problems that doctors are facing? Why are doctors becoming demoralized by this particular pandemic? The WHO recently said that healthcare workers are also being attacked by rocks and bleach for treating corona patients. Some have even stopped wearing uniforms to stay safe. So healthcare workers on the front lines of the world's coronavirus response are being attacked. They're hit with rocks, sprayed with bleach, kicked out of their homes, spit out, and even denied rights to work. The World Health Organization said in April that there were more than 35 serious incidents in 11 countries across the world of physical violence against healthcare workers. Sometimes this happens because of misunderstanding and lack of information and education, said WHO's Mike Ryan. And then, other times, these are senseless acts of violence and discrimination. When this is happening across the world, why would doctors not be demoralized, right? And I'm sure many countries are facing this problem, including India. Next slide. So we did have this problem happening in India as well, where mobs started attacking healthcare workers on COVID-19 duty in Indore. This happened again in Mexico, where healthcare workers faced violent attacks. Some of them were even sprayed with bleach in Mexico, which was very scary. If you go to Cameroon in Africa, the Cameroon doctors are asking for protection as attacks by COVID carriers increase. So in the face of this kind of demoralizing picture that we're going through, how are we going to stay happy? How are we going to get back to practice with joy and happiness? So what's the next problem that we could be facing? So these are problems that we are going to be addressing through our talk on how to overcome all these problems, which probably has resulted in us losing the joy in practice. Next slide, please. So the next problem that a lot of us as pediatricians are facing is obviously the financial crunch. Doctors' practices face a cash crunch as the pandemic halts economy across the world. As you see, the news also says that small businesses are affected, yes, but even primary care physicians are taking a financial hit. If you look at the US economy, it says there's a historic financial decline which hits doctors, dentists and hospitals, threatening the overall economy. There was an interesting article which also spoke about what the pandemic has done to my daughter's pediatrician's office. So we're seeing that certain doctors have gone on to even crowdfunding their own medical care as well as medical practice. Doctors need to start crowdfunding to keep their clinics as well as offices afloat. This trouble, I mean, even in India, we're seeing the salaries are being cut across hospitals as well as practices for many doctors. And this, in addition to the fact that we have to deal with coronavirus, deal with physical violence, is starting to affect doctors. Next slide. And let's not forget the most important problem, which we as doctors obviously have. Are we going to get the virus ourselves? We are in the front line, whether we are talking about sitting just in an outpatient practice, because we do not know who coming to us is carrying the coronavirus. So as we can see, a lot of doctors are very, very scared that are we going to get affected by COVID-19? Are we going to carry this virus back home and get affected and not only get quarantined, but are we going to transmit it to our family members, both our children as well as elderly who are at home? With this fear, next slide please, with this fear, we're always wondering whether we are doing the right thing by even starting practice. Should we even get back to practice? Because if we are going to face all these problems, how are we going to overcome this? How are we going to face these problems with joy and happiness? So as we know, the problems of pediatricians in these tough times are multifold. And the first problem which I realized was that there is an increased anxiety and depression. There is increased psychological problems that pediatricians as well as doctors are going to face, because this pandemic is not going to go away so soon. We are going to face it for the next 4 to 6 months. And is this going to affect each of us psychologically? If attacks on doctors continue across different countries, it is going to be demoralizing. And this is something which we need to deal with in different parts of the world. Financial crunch and pay cuts are something which is going to affect us. How are we going to deal with it? We may be exposed to the COVID-19, we may be quarantined. And many doctors who are also on COVID duty are kept at quarantine at hotels and hospitals for 14 days. How are we going to stay away from family and be happy to get back to work again? And finally, with that fear lingering around us, there is a high chance of us contracting COVID infection. So is anyone there to help us? Who can help? Is anyone doing anything to help us? Next slide. So in India, of course, there were some changes that we saw. The government did make some efforts. It said there was one day when in India there was a time when the Prime Minister announced that people come out into the balconies and clap for doctors. There was a time he said that why don't you take out vessels and make some noise to say that you are appreciating doctors as well as healthcare workers. As you can see in the picture, the President of India is clapping, saying that yes, we do appreciate the work that doctors are doing. Next slide. Subsequently, we also announced in the next sitting when the Prime Minister spoke, he said, why don't you switch off all lights? Let's go in for a blackout and light lamps in solidarity for all those who are on the front line working for COVID. Did this motivate doctors? May not be sufficient, but at least it was an attempt by the government. The next slide. The government then introduced a law which said that we have to pass a law against attacks on healthcare workers. It was passed as part of the existing law of the epidemic, but also said that up to 7 years jail could be given to healthcare workers, to people who attack healthcare workers. And the centre brought in a tough law with zero tolerance. Next slide. And finally, the most recent thing which the government tried out was to flower petals as well as put in petals from the army on doctors and healthcare workers as well as hospitals across different parts of India where hospitals were working with coronavirus, just to motivate doctors to say that the government is with them and that healthcare workers are not forgotten. These may be very small things which were done by the authorities to show doctors that they care. But did it help? Was it sufficient for doctors or not? Next slide. So I want to ask each of you doctors across the different panels that are these attempts sufficient to raise a pediatrician's morale? And who else can help us? Can I have the panelists on screen, please? So I told you about how in India we have different ways which the government tried to help the morale of doctors. We spoke about the different problems that doctors are facing across various facets. We will cover each of them and we will talk about how we can overcome each of them as panelists. But before I go, let me ask each of my panelists how it is in their country. We need to know a global perspective as to what governments and authorities are doing to help doctors and boost the morale of doctors in different countries. Let me first ask Dr. Sebastian Gray from the UK. How is it, Dr. Seb, in your country? Is the government doing anything? Is the authorities doing anything to boost the morale of doctors?
So I cover a lot of this during my next talk, which I'll go into in a bit more detail. But the government communication with the public in general has increased massively. There are daily updates informing the public of the processes, and understandably there is always going to be criticism. There will be criticism that it should have happened too soon, but likewise there are criticisms that it's happening too late. There is no way that anyone could have told the absolute perfect time for the country to go into lockdown and for restrictions to be put into place. What I think is really clear is that there are the effects directly from coronavirus, but we also need to consider the financial, mental health, domestic violence, safeguarding issues that are all resulting from families being in lockdown, not being allowed out of their houses, having restrictions put into place. There are risks associated with that. There's a lot of fear as well from the general public, and so there will ultimately be delays in presentation. Children who should be coming to hospital with illnesses that they would previously have come to hospital are staying at home, which means that we are hearing reports all the time of children with delayed presentations of serious infections, which is a massive concern. I think it sounds like a lot of governments, we as healthcare professionals have received a lot of support, and as a national health service, the financial implications for doctors aren't there like in other private industries and private countries and healthcare systems. So from that point of view, we don't have to worry, and we've been very much supported. We've even actually experienced some financial uplift in that the government have said, don't worry about it, we've got you covered. Financially, we will support anything you need as an NHS, as a national health service. They've written off debts. So my local hospital had £11 million of debts, which have been completely written off so that we can focus primarily on tackling COVID. I personally feel that the government has handled this very well, and it's tricky to get the exact way of dealing with it perfectly, but I feel that there has been absolutely efforts made.
Thank you, Dr. Sebastian. That was really nice to know that at least in the UK, the doctors are being taken care of. Dr. Smriti, how is it in Nepal? I mean, what do you think? Is the government doing sufficient to make doctors feel better? And how is the public reacting to doctors there?
Well, overall, doctors in Nepal are being treated relatively well by the general public. In spite of the lockdown, which is ongoing for the last 2 months, it's been quite easy for doctors to commute back and forth, like from the hospital back to their homes. The government is also doing the best they can. However, there's a huge discrepancy between the challenges faced by doctors working in government hospitals versus those working in private institutions. For example, almost all the PPE we are being given as a donation is being funneled into government sector, and even risk compensation and allowances are much more better for government employees. Most private hospitals are facing pay cuts and job insecurity. And similar to India, there also has been instances in Nepal where health professionals have been asked to leave the premises by their tenants as soon as a positive COVID case is detected in the hospital they're working on. So overall, of course, the medical fraternity as a whole is facing fear and uncertainty in our country.
Yeah, sure. Thanks, Dr. Smriti. Dr. Angela, could you elaborate how it is in Ghana? And if you can give us a little brief about how it is in the rest of the African continent as well, it would be great for us to know, because we get very little information here about how it is in Africa right now.
Okay, all right. So in Africa in general, we are starting to record pretty high cases of COVID. Testing capacities are gradually picking up in most African countries, and Ghana is doing quite a lot of testing, and so we are getting increasing numbers. But then the general picture on the continent has been that most cases have been relatively mild or asymptomatic, so the very seriously ill cases admitted in the hospitals aren't as much as we've heard about or read about in other parts of the world. So hospital capacities have not been completely overwhelmed yet, but then the caseload is still very high. And in Ghana, our government has at least made some efforts. In the beginning of the crisis, we had challenges with PPEs, but now with local production of PPEs, we have, it's not, of course, as much as we want it to be, but then there's some supply, and even though we are rationing mostly, it's at least available. And the Ghana Medical Association and Ghana group of resident doctors, they've also tried to raise some funds, and the general public has been very supportive. They've donated into this fund to be able to provide PPEs for doctors all across the country. So there's a helpline you call if you're lacking PPE so that they can support, and that has gone a long way. And the government has also tried with financially. Really, most hospitals in Ghana are more public, more government hospitals than the private sector. There are a lot of private hospitals too, but then government has tried to remove tax, so doctors in Ghana, health workers do not pay any tax since the COVID started, so that your salary goes up. And they are also given 50% increase in salary for people who actually directly work with COVID, take care of COVID patients. So that has actually helped to keep people calm a little bit, and the general public has been quite nice to us. Our main challenge really has been in the initial phases, we preached the stay-at-home narrative, and our patients listened. So now we're trying to find a way of finding a balance, so that we solidify the gains we made. For instance, with immunization coverage, people are not going out to take their vaccines anymore because we said stay at home. So that's the main challenge right now, trying to find a balance for continued, chronic care to maintain our patients coming back, and then for immunization as well.
Right. Thank you, Dr. Angela. That was a nice perspective to hear how things are going across the world. Especially in a country like UK, as well as in Ghana, as well as Nepal. So can I have the slides up, please? So what are we talking about right now? So of course the government is doing stuff. Of course a lot of people are trying their best, but still doctors are being demoralized, right? And who's going to help us? Is this what the government going to do, help us regain the joy in our practice? is what the authorities do regain our joy and happiness in clinical practice. As one of my colleagues today put it, saying that, what do you mean regain joy? We should not be losing joy in practice at all, right? But of course, it's inevitable with all the problems that I elaborated, that a lot of young doctors especially are being demoralized by the profession itself. Many of us are questioning, is it really worth practicing anymore? Should we look for alternate professions? Because if this is how pandemics are going to be, and this is how we are going to feel in a pandemic, how are we going to get back to practice and feel happy? We need to understand that you have two hands, one to help yourself and the second to help others. So it's important that we help ourselves. So today's talk and today's talks, which all our doctors are going to talk about, is how can we help ourselves? As doctors are helping ourselves across the world, how are we going to help ourselves here in India as well as rest of the countries? So I'll pass on the baton to Dr. Sebastian. Dr. Seb, can you tell me about how we can find joy during this COVID-19 period?
I'll do my best. So, so I was part of the IPA lead program, and one of my areas of interest has developed into joy and looking at how we can get more joy. And part of that is looking at the future. And even pre-COVID, we were looking at the Pediatrics 2040 project led by Russell Viner and the team at the Royal College of Pediatrics and Child Health. And I was lucky enough to be involved in that and become the lead for the wellbeing subsection to try and make improvements so that future paediatricians can really thrive in their working environment. So it's not just about how we deliver care, it's about how those that deliver the care are looked after. But to really understand where we are now, we need to really understand the baseline. And to do that, I really want you to think back 6 months, a year ago. What was it like at your work? Was it really joyful? I know Bharath's been speaking to some of his colleagues on Facebook that saying, actually, there's always been joy. It's not regaining joy because it shouldn't ever have been lost, but was there joy? Did you go in and maximise every opportunity and every positive experience? I think we all took things for granted. I certainly took for granted the ability to speak to my colleagues, not wearing a face mask and not being 2 meters apart. That physical contact without the risk and the worry. All these small things that we just took for granted. But we were already with a poor baseline. This was a study in America looking at how many different specialties experience symptoms of burnout. Pediatrics for many, many years was considered the happy, smiley specialty. But this pre-COVID data showed that paediatricians experienced, 41% of paediatricians experienced symptoms of burnout. There's many reasons to explain this, but there's not one clear reason. There's a lack of feeling valued, increased working hours, a lack of camaraderie amongst the team, a lack of teams full stop with shift-based working, and increased public expectations and understanding of what the role involves. But we were no longer the happy specialty, and 41% is massive. Burnout doesn't just affect the individual, it has knock-on effects to everyone in contact with that person. They're less likely to engage with things, and people are less likely to engage with them. The families and children that paediatrician sees have less satisfaction. They're less productive, and there's increased workplace accidents, exposing all of them around this person at risk. The overall quality of care is worse, and understandably, there's limited empathy. Burnout might not be synonymous with depression, but the two quickly become intertwined and can create this vicious cycle. If you're less productive at work and you're getting complaints because patients are less satisfied, that can bring you down. You start to experience symptoms of burnout, you become less productive, more patients become less satisfied, more people complain, and the cycle goes round and round. We need to find ways to break that cycle, and we need to find ways through COVID, but after COVID also. COVID was an unwelcome guest, and I remember when I first heard about what was happening in Wuhan at the end of last year. The IPA lead team were meeting in New Orleans for the annual American Academy of Pediatrics conference, which we were all very excited about. And at the conference, they had a biofire stand where you had to play a game and guess different viruses and bacteria in a question-like quiz. And you won a toy at the end of it, a toy virus or bacteria. And just by pure coincidence, I happened to win coronavirus, as shown in the picture. It looked very cute and innocently was placed above my desk in my office. So technically, I did bring coronavirus back from America to the UK. On the bottom of coronavirus, there's a poem, which I'll read to you now. The largest for an RNA virus, he's known to cause pneumonia and bronchitis. Bats and birds are ideal hosts. During winter and spring he appears the most. This fellow causes upper and lower respiratory infections, taking your cold in an unpleasant direction. Under microscopy his fringe is like a royal crown. The solar corona is the talk of the town. And by golly were they right. They got that prediction right. The COVID pandemic has also been known as the COVID infodemic. All of a sudden there was a deluge of information being bombarded from every angle. There were two extreme angles that existed, two camps, one that completely dismissed it as nothing to worry about, a simple, mild cold that will blow over, and the other that catastrophized it out of all control and was going to wipe out half the planet. Neither group helped, both potentially made it worse for the others. The COVID infodemic had begun, and it still hasn't stopped to this day. Never have the public and the physicians been so inundated with numbers, predictions, and personal opinions. Knowing facts from fiction and guessing from scientific modelling has become harder and harder. We, inherently as paediatricians, not knowing makes us feel uncomfortable. We don't like it when we see a patient and we can't tell you what's wrong with them. Is it a new illness? Is it a new manifestation or side effect or complication of a known illness? When we go home and finish, that patient stays with us. It stays in our mind and festers. It keeps us up at night worrying. COVID has done that to so many of us. We don't know what's going to happen. We can't tell what's happening. We don't know the future. And we don't know how to deal with it. And it lingers. It stays there. Family members and members of the public have had access to more information and various interpretations than ever before. We are now in a unique, completely different environment to any previous pandemic. So many people are deemed experts that expert opinion is meaningless. You can have one expert opinion saying the complete polar opposite to someone else, another expert opinion, that it makes it so difficult to interpret and so difficult to understand exactly what we should be doing. And that's where leaders come in. And leaders have diverged. We've seen fabulous, fantastic examples, the standout being the Prime Minister of New Zealand, Jacinda Ardern. Her communication throughout and decision-making has excelled. Clear, balanced, personal and concise communication has been amazing. Her reassurance that the Easter Bunny and Tooth Fairy are considered key workers brought glimmers of hope and joy and a laugh during difficult times. Unfortunately, not all leaders have had the same skillful communication. Unfortunately, some American citizens heard Donald Trump's statements about disinfectant. They interpreted this as encouragement to ingest hazardous substances, and they died. There was a tongue-in-cheek article, spoof, from the New England Journal of Medicine. You can see one of the authors is Meredith Grey, with a few other famous names there. And if you can't read it at the bottom, the conclusion is, this will kill you, don't do it. That message wasn't clear to the public, and we need to make sure that how we communicate is done effectively so that we deliver the clear messages with the effective evidence base as we have it. Modelling and predictions are all well and good, but the fact remains there are so many unknowns. We've all made our own plans in our own countries for what we think might happen, but no one's got it completely spot on. No one's been exactly correct in what they've predicted. And if you haven't got it spot on, there's the potential to feel demoralised, low and worthless. I'll be completely honest and open. I was very much in the camp that dismissed coronavirus when it first appeared. I thought it was going to be a mild illness that would blow over. As the numbers in China grew and the deaths were increasing, I felt embarrassed. When it started spreading to different countries and the deaths kept happening and it became a worldwide pandemic, I was mortified. I'm an eternal optimist, and that has its highs, definitely, but it also has the potential to set you up for a fall, and it felt like I was falling. Different cultures, different societies, different viewpoints. The world varies. But what shouldn't vary is this. It's okay not to be okay. And this will be repeated, and that's okay. No matter who you are, no matter what sex you are, no matter the colour of your skin, your religion, your standing in society, it's okay not to be okay. Just knowing this will help you get back to being okay quicker. But having people and places and signposts or resources to turn to should halt this depressing slide in mental health amongst physicians, stop the massively rising suicide rates that were happening pre-COVID, because as you could see from the initial slides, mental health problems are increasing due to this, but they were increasing before this as well, so we need to make some dramatic changes. Charlie Mackesy has written one of the most beautiful, uplifting, powerful books you could possibly imagine. The Boy, the Mole, the Fox and the Horse is worth Googling and adding to your shopping list. It's quite literally a work of art. It's full of wonderful pictures and quotes like this. Being kind to yourself is one of the greatest kindnesses, said the Mole. Now the Mole is obviously very wise. And it comes back to the old physician, heal thyself. In order to deliver the best care, we need to look after ourselves, and we need to change the way we look at the world. Now, I know you're all very intelligent viewers, and I know that you'll immediately spot that there's an error in this slide. 10 times 2 is not 25, but all the rest are correct. 9 out of 10 of these sums are correct, and yet we, as health professionals, will focus on that 10% where things have gone wrong. We need to learn more about focusing on the positives and the better things. We need to take a leaf out of the book from the Learning from Excellence movement started by Adrian Plunkett in Birmingham. We need to focus on appreciative inquiry and looking at everything that's positive and learning why it's positive and why things have gone well, and not just focus on the negatives. But sometimes things go wrong. When you look at these numbers, something else stands out. Sometimes when so much is going wrong, you do take more notice of the things going right. Those that were quick to view it will notice that only one of those sums was correct, and that's the one that stood out. Now, during COVID-19, when things are going so wrong, when times are difficult, there are glimmers of hope. There are gems that have emerged throughout this period. Processes and procedures that have been so difficult in the past have become easier. The red tape that stood in the way has turned green. Hurdles have been laid flat so we can progress to get those advancements done quicker, better. And as Bharath mentioned, there's been a renewed sense of appreciation. In the UK, there hasn't been any violence, not on a widespread level. The general public has been in such support of the National Health Service and healthcare workers and frontline workers and key workers. Every Thursday evening, people go to their doorsteps at 8 p.m. and they clap. And it's heartwarming and extremely welcome to most healthcare workers. But it does create some conflicting emotions. The biggest one of these is guilt. There are feelings that, do we actually deserve these people clapping for us? I mean, after all, we signed up to be doctors or healthcare professionals. We signed up to help people. Most of us are working in settings seeing children only. Now, we know from worldwide data that adults and older people and people with extreme risk factors are the ones significantly affected more than children. And of course, there are individual tragedies and every child death is unacceptable. But actually, we have had it easier than our adult colleagues. People working in ITU, people working in intensive care environments and emergency departments have been run off their feet. For many paediatricians, our workload has reduced. For others, national or international guidance has advised them that they have to stay at home. They can't even go to work. For them, the guilt is immense. The survivor guilt is there. But whatever your situation, whatever situation in life, you will always be able to find someone in a worse off situation than you. But why are we looking so hard for that? That clapping should act as a prompt for us to reframe things. I said a few seconds ago, we signed up to be doctors, to help people. But we worked hard for many years to help people. We go long periods not seeing our friends and family to help people. And we will still be there after this is all over to help people. If this is what it's taken for everyone to now appreciate that and go and clap at their doorsteps, to show their thanks, let them. We should feel proud to be healthcare professionals, and we should try and be gracious. This is Maslow's hierarchy of needs. And normally when I speak about this, I'm talking about how you need to reach for the stars and dream big and achieve every single thing you can. But actually during this period, self-expectations are important currently, and we need to reset those as well. We need to set realistic, achievable goals that don't dishearten you. We may need just to focus on our basic and psychological needs for now. It will feel at times like we're progressing, like walking through treacle. But actually, if we're still walking and if we're still going in the right direction, we're still progressing. And that's what we need to remind ourselves. We need to look after ourselves whilst we're doing it. Apart from toilet paper, which for some reason in the UK became very popular, alcohol consumption has massively increased. Lots of the public are using it as a way to ease the boredom of being in lockdown. However, I am hearing more and more from my health professional colleagues that many are using it to deal with the stress and anxiety. While this slide might be jesting, it's worth taking stock of alcohol intake and ensuring that you don't end up with problems post-COVID that you didn't have before. Having a couple of alcohol-free days each week is really important, and moderating when you do drink so that you can focus on looking after your overall well-being. And well-being will be spoken about by my colleagues later. But we've got to remember we're human beings. We're not human doings, and we just need to take the time every now and then just to be. If you can ease the burden of someone else as well to allow them to do it. They'll appreciate it. Teamwork is so important. I've always been someone who is a committee type of person. I love working together with people for a common goal. I enjoy the networking and building connections. So when all the conferences and face-to-face meetings started being cancelled and advised against attending, I couldn't have imagined how the virtual innovations that would have occurred to ensure that these networks can still work would have happened. I've lost track of all the different platforms I've used to virtually interact, including today's first time episode. But interact, present, learn, it's been amazing. And whilst I miss many, many aspects of that real life interaction, there's absolutely no way that all those previous meetings needed to be face to face. And moving forward, we need to remember that. There's been savings in time, money, travel. The environment has massively benefited. We need to take some of these and move forward. For our patients as well, for many, many years, we've seen them in a traditional format of families bringing their children out of their school environment, bringing them up to wait in a busy waiting room alongside other families and other children, and being called into a clinic room to have their review. Often they're well, often there's no need to do it. We cancelled all our routine outpatient appointments, but instead we arranged virtual clinic platforms. We could still see the face-to-face sick children, but for everyone with a routine appointment we saw them virtually. And guess what? Families preferred it. Children who I've never seen speak were in their element in their home environment. Physicians preferred it. It was more efficient. Calling someone in from the waiting room, having them come in, and then after the consultation, saying goodbye, gathering up the toys. It's amazing. When you add that up after the day, you probably save about an hour. There are efficiencies that can be introduced post-COVID, and there's definitely some benefits that have come out from it. Maya Angelou has this lovely quote. She says, "I've learned that people will forget what you said. People will forget what you did, but people will never forget how you made them feel." It's so important during these times of stress that you don't take it out on other people. As evolving leaders, we need to listen to staff, but we need to respond to their concerns about well-being. We need to follow the IHI, and we need to shift from asking the question, what's the matter, to what matters to you. This is the only way to enable meaningful conversations. We know from the evidence that leaders who actively listen are more likely to have staff who actively engage. And we need to promote a culture of psychological safety whereby any staff member can speak up if they're worried, sad or lonely. And this leads into psychological PPE. The media has bombarded us with reports about the availability of PPE, the level of PPE, the running out of PPE. We're sick to death of hearing about PPE. What we need to ensure that we don't forget about is psychological PPE, protecting ourselves against the psychological impact of coronavirus. I first heard this phrase through social media from Simon Fleming, known on Twitter as @OrthopedicReg. He introduced it at the induction programme at the Nightingale Hospital, which was a hospital purpose-built to manage COVID in London in the UK. Never has there been a more important time to look after your own mental well-being than now. And again, my colleagues will talk more about ways to do that later. Social distancing is a poor term to describe the physical distance required between two people to minimise transmission of COVID. At this time, socially distancing ourselves from others is probably the worst possible thing we can do. Now is the time where we should be reaching out to friends and family, touching base with old acquaintances, and watching out for those struggling with loneliness, and offering a virtual hand of help. We've got the potential now to look out for each other and build and strengthen relationships, and whilst we may need to stay physically 2 meters apart, we absolutely can get closer. But we need to look forward. The past is in your head, the future is in your hands. There is no benefit dwelling for too long, over and over, on the past, what went wrong, what we could have done different. We need to take the things that are useful, process them and learn from them, and then move forward. Even though the future seems far away, it's actually beginning right now. There are people benefiting from sitting in the shade of trees planted by people in the past. We're in a unique position and we have the opportunity to plant some trees for the future. I've heard many people discuss the term new normal, and people don't like it. New implies we're about to make the changes, but actually they've already happened. Advancements and improvements have occurred left, right and centre at an astronomical rate. By the time COVID-19 has gone, they'll be ingrained. It won't be new normal, it will just be normal. So my tips are: look after yourselves and don't set your targets too high. Look after others and be kind, always. Look for the positives. There are glimmers of hope and joy everywhere. But most importantly, look forward to the future. I like to imagine myself talking to my future grandchildren about COVID-19 and the pandemic that affected the whole world. And when I do that, it reminds me of being a child myself and talking to my late grandmothers, who unfortunately are both dead now, about World War II. I'm in a unique position of having my mother come from a German background and my father from an English background. My ancestors fought against each other in the World War II. When you study it in your history books and in your school, you read and learn about fighting, bombing, murders, dictatorship. It sounds horrendous. But the stories I heard, they weren't about that. The stories were about how whole communities were united and came together. Kindness and goodwill prevailed over anything else. And most importantly, when it all passed, both sides celebrated freedom and peace, and they built a better future. The same will ring true for COVID. The tragic deaths of thousands will never and should never be forgotten. The time to mourn them needs to be taken. But our children will remember being at home, spending quality time with their families, getting to know them at a deeper level. They'll never forget the renewed appreciation of going back to school and physically seeing their friends. They will celebrate the things that they took for granted, and they will cherish moments more than ever with those that they love, that they haven't been able to touch. So I encourage you all to look to the future. When it is over, and it will be over, you can be proud to have played your part. no matter how big or small, in fighting this horrible virus. More importantly, you will have taken stock of who you are, where you are, and the fortunate position you are in. I want us all to be able to tell our grandchildren what good came out of COVID-19 and how, through it all, we just found a little bit of joy. I'm going to pass you back to Bharath now, okay?
Thank you, Seb. That was a very, very interesting and motivating talk given by Dr. Sebastian. And I think hearing that, we all were very happy, and it brings a lot of joy just hearing him speak. And it's not surprising that within our circles of the IPA lead group, we call him Dr. Joy. So that was a talk by Dr. Joy himself. Thank you. I would like to go across a few other issues that we face. Of course, you spoke about how we need to look into the future, but in the present, I think a lot of us are facing two main issues, right? One is financial crunch, which I told you about, which is difficult for doctors. How do you expect us to be happy when our salaries are being cut? How do you expect us to be happy when, we don't have money, right? And this is one of the issues. Second thing is doctors who are being paid to work in COVID hospitals are being asked to be in quarantine. You're asked to be away from families, and many times you have to keep yourself away from family because you suspect you are exposed to that. So how do we overcome this problem? I think Dr. Smriti said you seem to have certain points on this, because we come from similar backgrounds in as far as India and Nepal is there. How are they dealing with these issues in Nepal, and how do you suggest doctors handle this? Would you want to put up some slides and tell us
about this?
Thank
you, Dr. Bharath. Yeah.
Can we have the slides up?
Can we have the slides up? Right, so as Dr. Bharath mentioned, let's now talk about the issues doctors are having to face in the wake of COVID, and how do we cope with them. Next slide, please. So many of us have had to stay quarantined. The pattern usually is 1 week of COVID duty followed by 2 weeks of quarantine. That means at least 3 weeks away from family. For some doctors, isolation has been by choice. We have heard stories about doctors moving into their garage and basements to protect their family. And for many of us, it's been forced on us. Most are put up in hostels or hotels in India and even in Nepal. That's how the trend is. And there are fathers out there who haven't even been able to hold their newborn babies for weeks. But I'm sure all of us realize we are doing this in an effort to protect our loved ones. Even for me, my greatest fear remains the fear of bringing the virus home to my children. Next slide, please. So what are the effects of this isolation time? Spending 2 weeks in one place, also described as cabin fever, can be stressful. So the strain of social isolation itself, the fear of the unknown and worrying for our own health and test reports can take its toll on all of us. The symptoms are all more made worse if you already have a tendency of clinical anxiety or depression in the past. And we are not just talking about present times. Periods of isolation can have long-lasting effects from PTSD to increased levels of family conflict and even a tendency to substance abuse. Like Dr. Sebastian mentioned, doctors are already into alcohol. So we don't want all those long-term habits to be a part of us post-COVID. From my own experience, what I find most distressing is the uncertainties. Me and my colleagues find ourselves fretting over how long this will go on, how many cycles of quarantine do we need to repeat, and how will the family manage without us, from homeschooling the kids to even washing clothes. Well, there's no shortage of things to worry about. Next slide. So how do we even begin to cope with issues like this? So first and foremost, it's very important that we realize and we accept our role as doctors. the longer we are in denial and try to shrug off our responsibility, the harder it is going to get. So be brave, face the challenge. And thanks to technology, it's super easy to remain connected with family. We've even heard of provision of free data plans for doctors. And we all are in this together, so talking to a colleague in a similar situation can help tremendously. Knowledge is power. We are lucky to have rapid updates and mobile communication. I'd also say be wary of oversaturation of news and misinformation, so just keep it right. Do not forget self-care while in isolation. In spite of being doctors, we sometimes tend to overlook our own health. We need to make an extra effort to take care of our mental health along with good nutrition, sleep, and exercise. And it helps to be optimistic. The pandemic sooner or later has to come to an end. Next slide, please. Let's look at another issue. This is another challenge which has been thrown at us. There's a lot of stigmatization of doctors going on in many countries. We have been constantly hearing in the news about frontline health workers being stigmatized, and I'm sure some of you have experienced it as well firsthand. In the media, there are horrific stories of doctors being kicked out of their rented apartments and being targets of verbal, emotional, and even physical abuse, especially in India. So blaming and shaping us in this way can be very hurtful and dangerous. It may also make us, soft targets for misplaced anger and hostility. It just adds on to our fear, and this in turn can hamper and our response to the pandemic itself. Next slide, please. So this kind of stigmatization can be very confusing and can lead to much unhappiness if not dealt with properly. So it is important to surround yourself with positivity and let go of all the negative vibes. We should realize that we should speak up if we hear or see any inaccurate statements about COVID-19, especially if it's targeted towards doctors. And we have heard of activities like mass applauses, which is in a way helpful, and even celebrities singing in support of frontline workers. But I still struggle to see how that is helpful. There actually is a guide produced by UNICEF for preventing and addressing social stigma associated with the COVID-19. And it is intended to support governments, media, and local organizations. For example, they talk about some do's and don'ts while talking about infected people. For instance, you can say people who have COVID-19 or people who are being treated for COVID-19 instead of tagging them or addressing them as COVID-19 cases or victims. Do Your Part in the UNICEF manual gives some insight on engaging social influencers and ethical journalism. It also has great information on communication, especially how to correct misconceptions and build collective solidarity. Next slide, please. We touched a bit on this issue. So there are a lot of financial issues that the doctors are facing right now, but it may differ from country to country and even within the country itself. Many doctors and paramedics, both in the Western world and in developing countries, are facing pay cuts as the COVID-19 pandemic is threatening the economy as a whole. And since a lot of elective surgeries and procedures have been significantly reduced, and in general there is a drastic decrease in demand for our services, this can bring down the institution's income. So in many countries, even senior doctors have been politely asked to take forced leave, and we are not even sure if they will be called back to their jobs once the pandemic is over. So the highest impact has been on those with individual private practices. With the pandemic going on for months now, doctors are beginning to worry How do they sustain themselves, pay off their loans and EMIs? To top it all, we may even face legal action, may we refuse our duty in the front line. Next slide. Well, it's easier said than done. While no one can predict when the pandemic will end, but ultimately business will return to normal eventually. And it's wise to anticipate that most of us will be back, will be able to rebound and recover a large portion of our lost productivity in the months that follow. Most hospitals like mine have changed their policies temporarily and have allowed extended use of vacation and illness time. And once the pandemic is over, we will be busy like never before with all the postponed surgeries, chemotherapy, elective trips to the hospital. The numbers of patients will rise. And as we all know, this pandemic will have a long-term health consequence. There will be a rise in other diseases, especially vaccine-preventable diseases. So the bottom line is we will not really be out of our jobs. Next slide, please. So I'd like to end my talk by saying that all of your roles are pivotal. We all are here in this together, and we shall joyfully rise above the adversities. Thank you.
And so now we're going to move on to Angela Osei-Bonsu, talking about COVID facing our fears.
Okay, so now we've heard so much about all the things that cause us anxiety, and we're going to talk about how we're going to try to face these fears. So then, as healthcare workers, as pediatricians, we're just like everybody else. We're also faced with all the uncertainties, all the anxieties that all other people are facing with the changing landscape of everything, the emotional turmoil that everyone is going through. But then, apart from what everyone else is going through, we're faced with increased fear because we are at increased risk of contacting the disease. In the background of limited PPEs, we fear that we'll get exposed at work and then take it back home to our families. We worry that we'll get exposed and then expose our colleagues at work as well. And so we have a lot of reasons to be worried about this coronavirus pandemic. And the other part of it is that the landscape of our work has changed. As pediatricians, we're used to, hugging our patients. The little children will come with their toys. We're used to playing with them, but then all of a sudden we have to keep a little bit of a distance. So it's actually not surprising that we have a lot of anxiety. But then we just need to understand that there's good anxiety and then there's the unhealthy type. But the healthy anxiety is exactly what keeps us going. It's what calls us to action. It's the good anxiety that reminds us to keep washing our hands well. It's when you remember all the risk you might pose to your family members, you remember to doff off your PPEs better, to use the hand sanitizers as often as you can. So that good anxiety is what is keeping us safe as much as possible, keeping us on our toes and helping us to adapt as much as we can to this situation. But then unhealthy anxiety overestimates the danger of the disruptive events and underestimates our ability to cope. So we just need to try to understand our bodies, how we respond, try to be aware of our bodies, how we cope with anxiety, so that if we are going down, we seek help as early as possible. So there's so much we cannot control about this pandemic, but what can we really do? So for this, I usually fall to the good old Serenity Prayer. We just need to have the wisdom to be able to know the difference between what we can change and what we can't really do much about. So as healthcare workers in these times, I think one of the biggest things we can do for ourselves is to try to find joy in the simple pleasures. We need to take our time to actually enjoy the moments that we have. I think before this coronavirus, we didn't know how precious a simple hug was, but now we kind of appreciate everything in a whole different light. So at the end of the day, when you close from work and you finally get into your room and you get to take off that mask, bask in that joy. It's relieving, like enjoy that moment of finally getting to remove all the restrictions from your body. And usually when I close from work and I finish going through all the weird new procedures now, taking off your shoes, getting rid of your clothes, everything, take a nice warm shower, and then you lie down. Just enjoy little moments, little pleasures. And as health workers, we work with information, so keep yourself informed throughout this process. Try to find trustworthy and reputable information from reputable sites, because there's so much information out there right now. I mean, they call it the infodemic. There's so much information, but just very little knowledge. You realize that there's so much. So let's try and find trustworthy information so that we can keep ourselves abreast with what's going on. You need to find trustworthy sites in your local setting, and it's also good to know what's going on out there, outside your local setting too. But even as much as you're trying to get information, minimize the news feed. If you realize that you're constantly getting overwhelmed with all the news, all the numbers, following all those figures out there, then limit it. I realize that sometimes it works well for me personally if I limit the number of times I look at the news feed, maybe once or twice a day, and try not to look at it too close to your bedtime so that it doesn't give you anything to worry about in the night. And then again, we have to watch out for each other. We have to be each other's keepers. Try to pay attention to your colleagues, because honestly, we are kind of in one big support system, a support group really, because our colleagues kind of understand what we are going through more than many other people. So let's talk to each other and offer psychological first aid to each other. What can we do? Again, we try to be kind to us, our bodies and our minds. Take care of yourself. You need to take care of yourself to be able to take care of others. Drink frequently, eat well-balanced meal, exercise daily. I think these things are already out there. Let's try to connect with family. Smriti already talked about connecting with family. Get enough sleep and limit alcohol or caffeine intake, because it's known to trigger panic attacks too. And then you just keep doing your best, because really that's the best you can do. I'm not a psychologist, but then these are some of the coping mechanisms available out there. I think there's so many websites and pages that would give you so many options for coping. But the most important thing is that this is not the first crisis you've been through. There's been other issues that caused you anxiety. So draw on coping skills that have helped you in the past. You know your body better than I do, or anybody else can do. So you try and use mechanisms and skills you have drawn on in the past that have worked for you. Take a time out. If you're feeling overwhelmed, just step back a little bit. Take deep breaths. Remember to breathe. Count. Just take a breath, really, because you also deserve a break sometimes. And schedule worry time. If you find that so many pressing things are weighing on your mind, schedule a particular time, put it in your calendar, and leave that specified time for worrying. I mean, it's first time I heard about this concept, I thought it was weird, but we procrastinate all the time. I mean, we all have that deadline that we've been trying to meet. Whenever the thought comes into your head, you tell yourself, I'll deal with this at 5 p.m. So do that with the worry. When the worry enters your mind, schedule that time and limit it to that period. And during that period, even if it's going to be 15 minutes a day, 20 minutes a day, whatever works for you, you can write it down. Write that thing that is gnawing at your brain down. Sometimes when you write things down, the thing that was consuming your mind so much may not feel so overwhelming once you see it on paper. That process alone can be therapeutic for some people, but then you don't have to find the solution to the worries during this worry time. It's just a period where you're allowed to immerse your brain in what is concerning you. And really, let's talk to a professional if you really need to. Talk to your friends, and then just don't be too upset if you have to talk to a professional. They really do help. And practice mindfulness. I mean, I just found that they said mindfulness is the awareness that arises from paying attention on purpose in the moment, non-judgmentally, with open curiosity, kindness, warmth, and compassion. Mindfulness is, as doctors say, a lot of the times we try to keep going. Even when things are overwhelming us, you try to make the patient feel good, and then you just keep going. Keep a straight face and keep going. But mindfulness is like, we just need to take the time to feel our feelings, Take a moment, whether it's at the close of the day, whichever time works for you, and just allow yourself to feel what you're feeling, because really, you are not wrong. Your feelings are not wrong. Your anxiety in and of itself is not wrong. So allow your body to appreciate what you're going through right now, not focusing so much on the future and or on the past, but be in the present. Allow your mind and your body to be in the present, to feel what you're feeling, so that you actually find solutions or seek help if you realize that you need to. And really, I think this cannot be overstressed, that it's really okay to not be okay. Eventually, we will pull through this as well. Thank you very much for having me, Medasi.
That was really interesting, again, to talk about mindfulness and how we as doctors need to also start implementing all these concepts into our daily life. And I hope this is not something that would be only with respect to this current season, but I hope that we use all these tips that we have discussed today to continue even in the future as we continue to practice, right? So I think it's Dr. Angela on. I wanted to ask her a few questions. Dr. Angela, are you there? I think there's some issue with her network back in Ghana, so we've just missed hearing her again. So I just had a few questions which I wanted to ask. Dr. Sebastian and Dr. Smriti, are you both on?
Yeah.
Yeah. So one thing I wanted to ask both of you is how do we deal with the false information which a lot of patients come with, right? We see a lot of patients coming with false information and a lot of misconceptions about COVID. How do we handle that without getting irritated? Because as a doctor, it's very easy for me to just get irritated and try to rubbish them, right? So how do you manage that, Dr. Smriti?
Yeah, so I think as pediatrician, it's not really hard for us to deal with such a scenario, because we've been doing that even before COVID, trying to, especially issues like vaccine hesitancy, and so we can counsel the patients and give them the right information accordingly. And I think pediatrician at large is excellent and very well trained to do so to start with itself.
Yeah. So that's it. There's one question that we have from Dr. Data from Uganda, and I would like to ask Dr. Angela to answer this question. I think she's back on. Dr. Angela, he wanted to ask if there are any active programs designed to help and respond to healthcare workers' psychological well-being in Ghana. So is there any programs in Ghana which are there to talk about psychological well-being of healthcare workers?
Okay, I think in Ghana there isn't a national program to talk about psychological well-being in doctors, but then it's facility dependent. There are so many CPDs that have been organized, a lot of CMEs and Zoom meetings organized by the Psychological Association in Ghana. So they are doing a lot of talks, gathering so many health workers together for these Zoom conferences. So that's what's being done. And then I know that in my facility, for instance, the psychiatry department has also been organizing regular webinars on psychological well-being for health workers. So it's not an official national program, but then I know institutions, various facilities that are doing their bit. Yeah.
Yeah, I think even in India we don't have any specific program which has been designed, but I do think that that is the way to go. If not by psychiatric associations, there are so many spiritual organizations as well which I think should take this up. What about in the UK, Dr. Seb? Do you have any specific programs which are handling psychological well-being of doctors?
There's not one unique endorsed program. I actually think there's been so much positivity that's come out of this with focus on well-being that actually the market seems booming at the moment. It feels like every society is focusing on this. I'm involved with the Royal College of Paediatrics and Child Health magazine that goes out to members quarterly in milestones, and our issue coming out in the next week is completely about well-being, and there's so many fantastic examples of initiatives that are going on up and down the nation, which is so impressive to hear. I think it's so clear that there are resources available. It's just finding what works for different people, and it's not the same thing for everyone. Some people, if you ask them to follow a mindfulness app and do some meditation, will look at you like you've asked them to eat a slug. it's not something that's going to work for everyone. I think everyone needs to find their own ways to deal with this crisis effectively.
I think you covered a point about saying how a lot of things are going digital right now. I read a lot of CMEs, a lot of webinars, right, going on at the same time. Does this mean that the conferences are going to end? Does this mean that doctors are not going to travel anymore? I don't know if that is going to be something which might upset us as well, right? What do you think?
I very much hope not, but I think I think the physical networking and seeing people in real life and that physical interaction is the best. I was about to say unparalleled, but it's not unparalleled. It's the best, but there are ways to do things which are more environmentally friendly without impacting as much. But I do think that those big conferences where you can network and form those connections for collaborative work, just like the conferences where we have all met overseas, has led to long-lasting, lifelong networks that we're going to work together for the rest of our professional lives. And that wouldn't have been possible meeting people virtually only, because I don't think those connections could have formed. So whilst I do think there is a massive appetite for some virtual and innovative practices to continue, I personally don't want to see the end of real life conferences. I would like to see them carry on.
Yeah, okay, thanks. So I think we'll wrap up this session because I think we're reaching the end of our time. And I would like to thank all the panelists, Dr. Angela, Dr. Smriti, and Dr. Sebastian, for such a wonderful discussion on how pediatricians and doctors can regain their joy and happiness back in practice. I hope this session was useful to a lot of doctors. It is going to be a recorded session, and I'm sure many of you can access it much later. So thank you once again to all the panelists, and it is great that we could connect with each other across the world in different parts at different times, and this was great to get a global perspective of what's happening at the rest of the world. So thank you all of you, and have a good day. Bye-bye.
Bye.
Bye.